Hello. Fixed bridges versus implants. I see a lot of patients that want to know, when do you do a fixed bridge and when do you do an implant? I've made another video on fixed bridges or implants, but we're going to take it to a different level with this video. The things that impact fixed bridges versus implants. In the anterior region, the lip line is one of the biggest determining factors. If the gingival line is not displayed when the patient smiles, then you're not worried about the gingival line. You don't have to have a symmetrical gingival line because you can't see it. I've placed an implant here and you can see that the gingival line from an aesthetic standpoint being symmetrical does not come into play. So in the anterior region, the biggest determining factor of whether I place a fixed bridge, means that's connecting to the teeth on either side, or an implant, is the gingival line. In the posterior region, it's bone. Do I have enough vertical bone for an implant between the alveolar crest, the top of the bone, and the floor of the sinus? If I don't, I'd rather not do a sinus lift and bone graft because that's a big procedure. It's expensive, it's involved, you've got to go through healing. It's fabulous if you need it and you don't have a posterior tooth to connect a bridge to. But if it was my mouth and I had a good posterior tooth to connect a bridge to, and I could place a fixed bridge and not have to have a sinus lift and bone graft because there wasn't enough vertical bone between the alveolar crest, that's the top of the bone, and the floor of the sinus. There's a sinus on the upper right and the upper left, then I would go with a fixed bridge. In the mandibular or the lower posterior, there's a big nerve right down here in the bone. If there's not enough vertical bone between the alveolar crest or the top of the bone and that nerve for an implant, you'd like to have at least 8 to 10 millimeters of vertical bone for an implant. There's some fat boy implants that are 6 millimeters long, but the typical implant is 8 millimeters, and you'd like a couple of millimeters between the apex of the implant and the nerve. So bottom line is, if there's not enough bone, vertical bone for an implant in the lower posterior, and you had a posterior tooth that you could connect a bridge to, because you've got to have a tooth behind the missing space and a tooth in front of it to connect a bridge to, then I would do a bridge. So this is a good place for an implant because you don't have to prep the teeth on either side for crowns. So remember, a bridge is like a bridge over water, with the edentulous space being the water and the teeth on either side being the land that the bridge connects to. So the bridge would go from here to here if it wasn't a single implant. A single implant is usually easier to keep clean. You don't have to floss underneath it like you do a bridge. So this is this case. He had a flipper, a removable partial, and so I replaced it with this implant. Here's the missing space, the implant and crown. That was the flipper. So the gingival line turned out very well, but it wasn't an issue because he had a low lip line when he smiled. His lip came to about right here. But as it turned out, the gingival line was not an issue. There's the implant. There it is. This woman has a low lip line, so an implant is good here because the gingival line does not come into play. You don't see the gingival line when she smiles. Now, if she had had a high lip line, that means when she smiles, she shows the whole world. All of her gum is showing, or the gingival line showing, then I probably would have placed a fixed bridge. See, that tooth was snapped off, so I'm going to place an implant because the gingival line is not a factor. There's that implant. We replaced the crowns on the adjacent teeth. There's the implant. See, so this gingival line is not an issue. It was fine as it was, but it didn't come into play. I might have placed a fixed bridge from this tooth to this tooth, if her lip line was not low, meaning the lip line came to about right here, so the gingival line didn't show. You can see it's not a factor. So generally speaking, I would normally rather place an implant than a fixed bridge, just because you don't have to prep the adjacent teeth. It's easier to keep clean. You don't have to floss underneath it. And the aesthetics, if the aesthetics is not a factor, and you have enough bone for an implant. This young lady had a higher lip line. The gingival line showed when she smiled. See, when she smiled, she showed gum. So I'm thinking fixed bridge here. See, this tooth was fractured and had an abscess, so we lost that tooth. So this is a fixed bridge. We veneered these other teeth because she wanted to lighten the shade from this yellow teeth. So from these yellow teeth, so we veneered back to there, and then we placed a bridge from here to here, and you can see how I create a gingival ponic receptor site, which is like a foxhole in the gum, and it makes that false tooth or ponic look like it grew out of the gum tissue like a natural tooth. So the bridge is from here to here. That tooth was lost, and then veneers on the bicuspid and cuspid teeth so we could lighten the shade. Veneers here. There's the bridge. You want to be sure that the false tooth or the pontic blanches the tissue when it's put to place, so it looks like it grew out of there. But see, her gingival line was displayed when she smiled. So in those cases, I'll generally go with a fixed bridge because I can control the gingival line better with a fixed bridge than I can with an implant. Here's another case. This woman had bridges placed, and you can see she's missing her lateral incisors, and see how those look like fake teeth. They don't look like natural teeth. So this is her before. These are the bridges from here to here and here to here, and these are the artificial teeth or the pontics, there to there and there to there. So I removed those old bridges, re-prepared the teeth, and see the gingival ponic receptor sites had not been created. So I create these, which is like a little foxhole, and that pontic or fake tooth is going to rest in that site, and it will make them look like they grew out of the socket. So you want to be sure to shave the stone model, about 5 scrapes of pencil painted on it. You can watch how to do that in the Library of Dentistry Masterclasses.com, so that when you push the bridge to place, the ponic area blanches the tissue. You want intimate contact between the pontic or the false tooth and the tissue, so you don't get food collection under the ponic and it looks like a natural tooth. So these are the false teeth right here after I've remade the bridges. See how they look like they grew out of the, this is after. There's the pontic or the false tooth, and so bridges connecting from here to here and here to here. This is her before. You can see how these they don't look natural, but see how she shows gum tissue. So that's why I went with a fixed bridges versus implants, because too much, she displayed the gingival line. This woman broke this central incisor. The gingival line was just kind of an issue. You possibly could have gotten away with an implant, but I was afraid she'd show more gingival line when she smiled real big, so we extracted that tooth, placed a fixed bridge after creating a gingival ponic site. So this is a bridge from here to here, and then we also veneered this tooth to make this one look like this one. See how that looks like it grew out of the gum line. This gentleman, his gum line was just barely displayed when he smiled. So you probably could have gotten away with an implant because he didn't have a display of the gingival line very much, but he did just a bit. So I decided to go with a fixed bridge in this case. You can see we lost this tooth. It had broken. I removed that tooth, and this is a fixed bridge, and see how that ponic blanches the tissue. This is the bridge from here to here, and then we also placed a veneer on this tooth. Normally, if I'm placing a bridge on 3 anterior teeth, I'll veneer the adjacent lateral incisor just for symmetry. Remember, the cuspid teeth are always about a shade darker than the anterior teeth, so it's not such a significant thing to veneer that. But if I'm doing 3 teeth, 3 incisor teeth with a bridge, I'll normally place a veneer on the adjacent lateral incisor. So this is the fixed bridge and this is the veneer here. So as I said, in the anterior region, it generally has to do with the gingival line and the display of the gingival line when the patient smiles. If they display the gingival line, I'm probably going to go with a fixed bridge most of the time. If they don't display the gingival line, then an implant is often my choice. This was a really complicated case. This young lady had some retained deciduous teeth, some spacing issues. We had to do some orthodontics. So this was a retained deciduous tooth. This was a retained deciduous tooth. What you're trying to do here is create some spaces that are large enough for a full tooth and not just a half tooth space that makes the ponic or the artificial tooth or the implant look artificial. So you either want the teeth to be close together so you can place a single restoration on the tooth and it has a normal width, or you want the space to be wide enough that you can place a full tooth in that space. And so this is a deciduous tooth. It's going to be extracted. And deciduous tooth over here. The deciduous cuspid. We first did some ortho. This is the deciduous cuspid on the right and the one on the left. So these are after those have been extracted, and we also extracted a bicuspid tooth for orthodontic purposes. And then we're moving the centrals together. So we've extracted the right bicuspid to make enough space for the restorations. And I wax it up ahead of time. I want to know what something's going to look like in the end before I start. So always know where you're going before you begin, then you can make that happen. So this, I know if I can wax it up, I like this better than a computer image print. I'd rather have it waxed up because I know I can do this if I can wax it up. So these are some surgical guides. These are where the implants are going to go. So there's the implant on the right, the implant on the left, implant. So I want this space to be large enough to have an appropriate size tooth or ponic in that space. You'll see this is just right for a lateral incisor, and then we're place a bicuspid here. So this is the final restoration. These are the pontics, so bridge from here to here and here to here. Crown on this, on the bicuspid over here, and the bicuspid over there. Fill that space. That's the dental minute. These techniques work, and they work every time.
Are you feeling stuck? You know you have more to offer and you can elevate higher in your dentistry practice, but you just don't know how to do it? Well, great news. DentistryMasterclasses.com is here for you. At DentistryMasterclasses.com, Dr. Cutbirth is offering his greatest work and his best cases. Here's everything included when you subscribe to DentistryMasterclasses.com. You will get incredible comprehensive cases not seen in Dental Minute videos, an organized library of all the Dental Minute videos, and the Dentistry Masterclasses, comprehensive cases for study and reference. You will get before and after pictures of Dr. Cutbirth's fantastic restored cases. And guess what? All of this is $40 a month. That's right, $40 a month. This is an opportunity you cannot miss. Go to DentistryMasterclasses.com and subscribe today.